The following program is sponsored by Jewish Federation of Palm Beach County and the generous gifts of these contributors.
Welcome to our 46th season of Mosaic. I'm your host, Susan Shulman Pertnoy. Mosaic is Jewish Federation of Palm Beach County's weekly news magazine, exploring the most critical issues facing Jews here and around the world. Mental health is a national health crisis, and it's no different here in the Palm Beaches. Today, we'll talk with professionals from Alpert Jewish Family Service to find out what the local needs are and how our federation is helping to tackle this important issue. That's today on Mosaic. We're so proud to celebrate our community visionaries, donors who contribute $1 million or more, serving as an inspiration for all of Jewish Palm Beach.
The Activate Jewish Life movement is a first of its kind. Intends to connect with families with children, to connect with teens, to connect with young adults. However people want to engage with Jewish life, we want to make sure that we are providing them with an opportunity to engage in ways that have relevance and meaning for them. What an opportunity we have to change the face of Jewish life.
Welcome back. Today we're tackling the subject of mental health. And joining us is Dr. Elaine Rotenberg, the Chief Clinical and Impact Officer for Alpert Jewish Family Services. Elaine, it's such a pleasure to have you back on
Hi,
Mosaic. Susan.
It's great to be with you again, as always.
Can you give us a little bit about your background and what you do at JFS?
Sure. I'm a licensed clinical psychologist, and I've actually been at Jewish Family Service for over 32 years, I think, at this point. And I oversee some of our programs, specifically our mental health first aid, our domestic abuse program, our life planning program. But I do a lot of strategic involvement and partnership in the community with our local partners, both in the Jewish and the general community, and really just doing everything I can to communicate about our message about strengthening families and being there as a resource to people when they're hitting challenging times. So it's kind of a big activity.
I would say so. And you've been dealing with a lot of challenging times. I mean, the last time you were on Mosaic, we were just in the middle of COVID, and you were dealing with the tremendous amount of challenges with people suffering from COVID, loved ones dying, not doing well, and caregivers.
Right.
So now that we're through with COVID, where does mental health stand now?
I'm so grateful for that question and to be here today, because when I was here last time, I spent a lot of time with you and with our community talking about the fact that COVID gave us a new backdrop, that we were living our lives with the backdrop of this global pandemic, with all that that brought about in terms of our fears, worries about our health, our safety, our loved ones, and the losses. And the message at that time in terms of mental health was that despite that, or in spite of that, we still have day-to-day challenges that we need to face. So even though we had the pandemic, people are still dealing with divorces and deaths and mental illness and trauma and all sorts of things. And we have to navigate that on top of this new backdrop. What I said to you then was that what we had to really worry about was what was called the shadow pandemic, which was not the immediacy, but what was going to happen years later in terms of managing the ramifications from the pandemic. As a Jewish community, what has happened to us in terms of mental health is that unfortunately we've been hit with another trauma.
Absolutely.
And the trauma we were hit with October 7th, 2023, has given us as a Jewish community a specific, unique new backdrop. And we need to think about that in terms of the fact that we may not be talking about it every day, but it is our new collective backdrop as a Jewish community. Knowing that, everything we talked about in terms of the pandemic is true for this as well, meaning we still need to navigate how to be in our life, how to lose jobs, how to deal with aging parents, how to deal with caregiver stress. And so, for example, at Jewish Family Service, a lot of people may not know, we have our own home health agency. So it can be such a relief in terms of someone's mental health when they're a caregiver to know that there's a place to turn when they need in-home support. So they can call us and they can get an in-home caregiver, which people may not know. Similarly, in terms of mental health, which is it is our whole subject today, is that, there are things that we all feel, a little nervous, a little scared, a little frightened, whatever it is. That's normal. When those things become so extreme that it impedes our functioning day to day, that's when we know we need to pick up the phone and not be alone with that and maybe talk to a professional.
So some of the unexpected, to the layperson, ramifications, that we're using that word today, of the horrors of October 7th, are the children of Holocaust survivors.
Yeah.
They are experiencing incredible anxiety.
Yeah.
Are you seeing that in your practice?
Absolutely. First of all, at Jewish Family Service, we work with hundreds of Holocaust survivors. And Holocaust survivors come with children and grandchildren. And some of what we're seeing right now in terms of what has come out of October 7th, particularly a few weeks ago when we saw the physical change of the one survivor that came out, and people saw that and compared that to pictures they saw with Holocaust survivors coming out. The grandchildren of our survivors, the children of survivors who have grown up hearing about that, are now feeling more fear. This could happen today. I tell this story about a young woman who is a grandchild of a survivor who, after October 7th, was literally driving cross train tracks on her way to work, and she had this flash in her mind of, oh my God, what happens if we all have to get put on a train? And she was just going to work, but that popped into her head, and that is we have generational trauma as Jews anyhow. It's a collective trauma, and we sometimes don't know that we're carrying it with us. And so obviously, you're thinking, why is it I wasn't there?
Right.
But we as a Jewish people focus so much on community that recognizing that we are going to be triggered by those kinds of things is important in terms of our mental health.
Absolutely. And what about the rampant antisemitism now that college-age students are facing all over campuses?
Right.
I mean, that's another layer
Right.
of mental health issues that's traumatizing.
Right. And so that is so important to realize in terms of our younger generation. And so where does mental health come in? Mental health comes in because sometimes somebody needs more than just, they need more space to talk about that. Maybe they are anxious. Maybe they're not sleeping. Maybe they're crying. Maybe they are isolating. Maybe they've never gotten out beyond their isolation after COVID, and now they just want to shut down even more. They're having trouble at work. They're having trouble at school. Kids don't want to go to school. So all of those things are important to understand that there is a place to turn. We have mental health services where somebody can go and talk to a therapist and really not feel like it's not an okay thing to do because they're struggling a little bit more than would be helpful for them. We're all struggling a little bit because this is not an easy time, but we also all know ourselves when it's interfering with our functioning day to day. And that's when we need a little more help.
Elaine, we have so much to talk about, but I have to take a commercial break.
Okay.
We'll be right back after this brief message. Ahead, we continue our discussion of mental health with Alpert JFS. Stay tuned. Did you know that you can now enjoy Mosaic on the go? Listen to the Mosaic podcast by scanning the QR code on the screen or find it wherever you listen to podcasts. We're back chatting with Dr. Elaine Rotenberg, and we were discussing October 7th and the unique consequences in the mental health arena, and we just left off with college-age students, and
Right.
You were going to mention what type of a program you might be looking at for them.
We've been thinking a lot about how we educate our youth to both talk about mental health, and we have a wonderful program that we've had for years where we teach teens to talk to other teens about bullying, about healthy relationships, and we're hoping to be able to expand that to teach those kids about how to stand up to anti-Semitism, how to understand some of what's going on, in the hopes that they're going to then be able to move to their college campuses with a little more knowledge, a little more kind of Jewish self-esteem, as I would call it, a little more ability to be assertive. Knowledge is power, right?
It absolutely is. Are you finding that people are reticent about coming for help? Is there they still feel stigma? There's a stigma to getting help?
Yeah, it's continues to be the reality that less so. People recognize, and you see talk about mental health everywhere, but I think there's still a little resistance to saying, I need to see a therapist, I need to see a psychiatrist, I'm struggling, can you help me? And that's what Jewish Family Service is there for. There's one telephone number. I have my magnet to give you. I don't know where I left it here, but it's got that one phone number, 684-1991, with one telephone call. The beautiful thing about the way we've structured Jewish Family Service is that when you call, you don't have to name a specific program. All you have to do is say, I need to talk to somebody because I'm struggling. And then we use master's level professionals who are going to be the ones to take that phone call. And they will help you figure out what we might have to offer you or where else in the community you might need to go, because we don't always have all the answers.
Right.
But the idea is to do a comprehensive assessment so that when you make that phone call, which is sometimes so hard for people to do, you don't have to make 12 phone calls. We will help you figure it out. And that's the unique thing, and having a real holistic view. If somebody is calling about their parent, they also may need help because they're struggling. Or somebody may need food from our food pantry. Or somebody may not be able to afford services, which is part of what we're going to talk about with our amazing mental health fund, which is just a fabulous thing.
Tell us about your outreach programs.
Right. So we spent, this is part of outreach, right? But outreach, we're working very hard to be partnering with all of our partners in the Jewish community, specifically to let people know that there are services available. They do not need to feel that there's a stigma about asking for help. We've actually recently expanded the position of one of our psychologists, Dr. Iris Kiner, and her position is now the Director of Jewish Community Connections. And what's wonderful about that is that we're working in partnership with the Federation's Connections program and training their connectors to understand about mental health, to understand about the resources at Jewish Family Service, to understand where
Very
to go,
important.
to understand where to go if they need a home health agency, to call Jewish JFS Comfort Care, to where they go for a psychiatrist, because you get rid of silos that way, and we're connected. And it also helps with the stigma. If you're
Yes.
training, regular folks, not mental health folks, to talk about how to approach somebody who may be hurting, who may need help, you normalize it. And normalizing it helps get rid of the stigma.
Absolutely. No, it's a terrific collaboration, and it really is, and so needed. Could you tell us about your first aid program and how that's going?
Oh, thank you. It's mental health first aid. Have you taken it yet?
I haven't. I need to take it.
Well, we're going to get you into a class.
Okay.
So mental health first aid is like first aid and CPR, but came to the United States in 2008. There have been hundreds of thousands of people, actually millions of people, trained in mental health first aid in the country. We brought it, Jewish Family Service brought it to Palm Beach County, and it is an 8-hour course to teach ordinary citizens, not mental health folks, how to recognize a potential mental health or substance use crisis, how to approach somebody, how to assess for safety, how to say to somebody, "Are you okay?" How to see somebody and not be afraid to ask them if they're thinking about hurting themselves, to help somebody get to the help they need. And I'm really proud to say that we've a coalition of mental health first aid instructors through Jewish Family Service, and we've trained in our community over 14,000 people.
Oh my goodness.
I know, it's a lot.
That is a lot.
And so what's exciting is, we're certainly reaching out to all of our partner agencies. So we're training all the Jewish professionals, we're training, local police, we're training, librarians, wherever we can. It's a really important program. And actually, if somebody wants to take a mental health first aid class, there's an adult version and there's a youth version to recognize mental health issues in kids ages 13 to 18. We're doing a program this weekend called Clicks and Consequences, which is for parents and youth, 5th through 12th grade, about internet safety.
Oh, very
So
relevant.
Very relevant. And so
Yes.
those things all connect to mental health. And so we think of ourselves, Jewish Family Service, we are the hub of those resources. And I think about it as sort of the tentacles to keeping the health of our Jewish community going, in terms of...
Yes. There's so, you are the hub
Yeah.
of mental health for our community.
Yeah, and
Truly.
for the general communities, we don't just serve the Jewish population, obviously, because we're a human service agency, but certainly our reach is into the Jewish community as well.
We want to hear more, but we have to take our final break.
Okay.
Coming up, we explore how you can support mental health awareness here in the Palm Beaches. That's next on Mosaic.
Since October 7th, we have seen our community come together in ways we could not have anticipated. And that's what led to the Activating Jewish Life movement. The Activate Jewish Life movement is a first of its kind, intends to connect with families with children, to connect with teens, to connect with young adults, and ensure that they always feel as though they're part of something larger than themselves, being part of a larger Jewish community. It's such a unique opportunity to be able to launch a bold initiative just like this. The Activate Jewish Life movement is going to be a game changer. However people want to engage with Jewish life, we want to make sure that we are providing them with an opportunity to engage in ways that have relevance and meaning for them. Thanks to our partners in the Jewish community and our Federation agencies, what an opportunity we have to change the face of Jewish life.
Welcome back. We're here talking with Dr. Elaine Rotenberg and Eileen Berman, who is a major supporter of our Jewish Federation and JFS. She's also a founding contributor to a new mental health program that we have. And before we talk about it, I want to ask you, you talk so much about the mental health, but what's an obstacle to mental health here?
Well, one of the biggest obstacles, especially in the last few years, which we didn't touch on before, is how tough the economy has been for people. There are many people in the Jewish community that have now overcome the stigma but can't afford the services. And they can't afford to see a therapist, can't afford to see a psychiatrist. And thank goodness, and Eileen and other contributors have changed that for our Jewish community now, which is remarkable.
Eileen, why did this call to you?
I think it started with just general knowledge, reading the newspaper every day about the issues that are facing the youngest to the most elderly in our community with mental health issues. And I was clipping articles and talking to people about it, and then had the opportunity to meet with the CEO of Jewish Federation, Michael Hoffman, and his senior staff with several friends of mine, and we were discussing where we wanted to put our energy and our finances to alleviate a problem in the community. Then we had the opportunity, after looking through a range of things, to hear Dr. Rotenberg speak at a symposium about the integral issues that were happening throughout the entire community. At that point, we hadn't been focused specifically on the Jewish community, but when we realized that in this small community here, locally, there were such vast issues and vast problems, we decided we wanted to do something about it. And that's how we decided. We drilled down and decided that we would start a mental health fund.
It's fantastic. Elaine, what is the headline of the fund?
The headline of the fund is "We do not have to turn away a Jewish individual of any age who is needing mental health or psychiatry services."
And that was really the impetus for it, that we learned that as generous as the Jewish Family Service is and how many people they were serving, there was no end to the list. And we said we need to do something about it. So we created the fund. Fortunately, over a little bit of time after that, a number of other women in the community who have been generous in many ways decided to amplify by contributing to the fund. And our goal was just to get that list of people who needed therapy reduced as much as possible.
That's fantastic. How do you go about encouraging other people to contribute?
I think by just, telling the story, introducing them to people like Elaine, who are so knowledgeable, and the staff at Jewish Family Services, all were available to us. We met with the CEO, we met with other people on the staff, both on the Federation side and the Jewish Family Service side. And, we educated ourselves so that we could go and tell the story to other people and hopefully be influencers.
And it's remarkable, and we thank you so much, because by doing this, it has not only helped us not have to turn anybody away, but it also helps with the message about stigma and that we were talking about before.
How do you promote that this is an opportunity for people to get them to take advantage of it?
Well, when people call, we have the centralized
Right.
intake, and so when people call, we're able to tell them that. And in terms of the fund, what's so important is that people continue to support it, because those dollars are specifically going to cover the cost of a therapy session or a visit with a psychiatrist. And so there are concrete numbers of human beings that we are helping with this fund, so we need to keep it a thing.
Well, also in light of October 7th, I must say,
Yes.
the onslaught of Jewish needs in particular are going through the roof.
And I think that propelled us just as another added, really just horrible situation, not just here, but globally as well. And we all became very sensitized to the need and what the eventual need was going to be. And I think because of that, we realized we needed to be funders. You know, that's unless we provide the funding to help from the youngest to the elderly deal with these problems, there was just no end to it.
And when Eileen talks about that, it's when we talked about before about our new backdrop. I mean, October 7th is a new backdrop for our Jewish community, whether people talk about it out loud or not. And that is bringing, I know even as we talk about it, we can feel our own sort of anxiety and sadness and all those things. And there are people who are paralyzed by those feelings who need help in terms of mental health.
And also a lot of people don't want to talk about mental health issues. It's very painful, it's rampant, and it impacts so many people. Sometimes you feel yourself like you're having a mental health crisis because it's just so difficult. However, I think that by doing what we're doing, and by the fact that also both the Jewish Federation and the Jewish Family Service have been getting the word out through media, through programming,
especially the Connections program. It's just
the Connections program, and then the people who have contributed to this. I think we're probably 10 or more people now, but there should be many, many more. And we're hoping to influence more people as they learn about the needs to realize that this is home for us. Right. This is home, and we need to take care of our people here.
And our community.
So well said. And do you have any final words in terms of what you would like for the future of this program?
I would love for the future of this program to continue to grow, to have people continue to contribute to it, so we know that our Jewish community is supporting the people in it from a mental health perspective and removing that financial barrier to getting help. It's hard enough to deal with our own angst, not having to deal with, on top of that, how do I pay for a session with a psychiatrist? So.
And I think we're very dedicated to making sure this is something that's not a one-shot deal, that there'll be repeat pledges to this, that we hope we can eradicate the problem, but barring that, we want to help in every way we possibly can in our own community.
It's a wonderful gift that you've done.
It is a really very special mitzvah that you've done.
Thank you.
We need to keep it going.
Yes. Thank you, and thank you for joining us today.
Thank you.
This program is sponsored by Jewish Federation of Palm Beach County.